Recording. All right. Hello, everyone. My name is Dr. Chris Bowman. I'm a pediatric and family chiropractor at Trailhead Family Chiropractic in Murrieta. And today we are so blessed to have with us Dr. Alisha, who is an ND. I've been referring a lot of patients over to her lately because of her expertise in knowing nutrition and hormones, stress, all of that stuff that goes beyond kind of what I do on my day in and day out. And really when I'm looking to get to the root cause of, like I said, a stress problem, a hormonal problem, a digestive issue, I've been sending them to Dr. Alisha and have had really, really good results and really good things my patients are saying about her. So I thought I'd bring her on, especially as everybody's kind of looking for health information at this time. What can I do to protect my family or help my digestive system or help my immune system? And so I figured I'd just get an expert on here and ask her questions, honestly, that I have. What type of things can I do to help my family? And I figured it would benefit you guys and whoever else is watching this as part of our community as well. So Dr. Alisha, thank you so much for being with me today.
Oh, thank you so much. I really appreciate you having me. And yeah, it's super fun to share patients with you. And I so appreciate your referral. So thank you.
Of course. So first off, before we even get into the questions, I'm sure some people are like, did he say MD or ND? If he said ND, like what is that? Would you go into that just a little bit about maybe where your education differs or how much you have or what the qualification means, like that type of stuff?
Yeah, so an ND stands for naturopathic doctor. And naturopathic doctor has a 4-year medical degree. So after your 4-year undergrad, a medical doctor goes to a traditional medical school. Mm-hmm. And really, as we all know, as a culture, their one thing that they can prescribe is medication. Your medical doctor, really, that's their only tool in their toolbox. Mm-hmm. I chose to become a naturopathic doctor because I knew innately, before I knew what even that was, my intuition told me that there was something more. And I wanted more tools. And so a naturopathic doctor goes to a different school. You still learn pharmacy, but in addition, you learn a whole different modality of different healing tools.
Hmm. So what does that include, the healing tools?
So, like you said, do you hear that echo on your side? Mm-hmm. Okay, I'm hearing myself like it's.
Maybe I'll turn my speakers down.
Yeah, I think that's better. Thank you.
Yeah, no worries.
So a naturopathic doctor, like you said, what tools do we learn? Well, the tools that we learn do include, we all believe that nutrition is the foundation of lifestyle. So we actually do learn exercise therapy. We were actually taught actually different mobilizations. I cannot do a grade 5 adjustment. And actually, I don't do any manipulations or whatever we need to call them. Yeah. Yes, mobilizations. We took the classes. And so for a while, that was fun. One of my favorite tools is homeopathic medicine. And that is a German medicine that's over 200 years old.
Wow.
And I've seen miracles happen for myself and for patients. Other modalities include botanical medicine, physiotherapy, so the use of different machines. I think in your office, you might utilize some. Do you do e-stim?
No, we do adjusting because we focus mainly on kids and pregnant ladies, so we don't want to focus on them.
Yeah, no, we can't have any frequency with that. So yeah, those are kind of a handful. We learned so much and it's hard to practice it all. So when you asked me, I'm like, what else did we learn? You know, there was a lot there.
Yeah, that's it. Just having that conversation alone, I'm sure some people are going to be like, oh my word, like that. Why not go to somebody that has a wide range of tools rather than somebody with a narrow, not necessarily narrow scope as much as a narrow perspective. You know what I mean? You can come at it from a body mechanics standpoint, from a physiology standpoint, from a neurological standpoint, from multiple different issues. And that's, I think we work well together because we're not so much is focused on a symptom as much as we are focused on how the body is systematically working.
Yeah.
So that's kind of what we're going to get into today. We have a couple different things that I want to talk about. The first thing being food. Obviously, with all the processed foods flying off the shelves and you can't get them, maybe it's a thing. Some people might have to choose to cook stuff they wouldn't normally cook. But if they're looking for, just in general, if I'm trying to fight inflammation, or let's say we're going to use this time to do a diet reset, or like something like that, what type of anti-inflammatory food would you say are your top 2 or 3 to try first? And what might be the best way to prepare them, as far as steamed, or just put it in a smoothie, or roasted, or things like that?
Yeah, great. You narrowed me to 2 or 3, but so
5 or 6, whatever you want.
Okay. No, but I like that, because I my intention is that people not just watch this, but that they actually take one act, even if it's just one thing, whatever that one thing is, you implement it within 24 hours. So if you're watching this, I want you to take that challenge and let us know what that challenge is. I want to share my contact information later. Yeah. So one of my favorite things is chia seeds. They're a seed that delivers high omega-3 fatty acids. And we know omega-3s are immensely important in our brain. So if you are a mom, a pregnant mom, you have a baby, you need omega-3s. And chia seeds are, I think, an affordable and easy way. How I do mine is if I'm making a smoothie, I pour them in there. They do turn pretty kind of thick and gelatinous, so you could contrastly make a chia seed pudding. Those are easy to find recipes online. And so that's a great, just easy way, about a tablespoon a day, and that will help boost your omega-3 levels. And I do test those in the blood. So it actually, you can see a measurable change, which is so fun, when somebody goes from a deficient omega-3 fatty acid status to, an optimal level.
Right. And not just from because how we think is, we don't try to take a level of like a specific number and just try to bring it up to another number. We know that when you're at this number, like you talked about, it affects the brain. Like the brain is inflamed, and taking this number to this number has downstream effects. Excuse me.
Yeah. Good job covering that elbow.
Right.
So one of my other favorite anti-inflammatory, it's not a food, I guess technically it's a root, but ginger. So ginger is wonderful. It's really warming. It can be great on a stomach, an upset stomach, like with your population being maybe prenatal, for nausea. And the way I'm not usually a fan of ginger. Like sometimes it's just so strong, but a little bit can go a long way. So whether that's you're making a stir fry with vegetables, and I'll talk about one of my other few favorites, maybe put a little bit of ginger slices in there. My husband and I, we have a new favorite morning drink, and our morning drink is called, he named it, so cute, G Calm.
Nice.
And so later we're going to talk about the gut, which I'm really excited about. And what G Calm stands for is ginger, cayenne, apple cider vinegar, lemon, and just a little dash of maple syrup. And I have a recipe on my blog site, and it's just delicious. So I make a batch of this. And we, so that's great. And then so you said 3, I'm going to start with 3, is a toss up between kale or broccoli. We always have organic frozen broccoli in our freezer. It's just a staple. And when it comes to, fresh and frozen right now, like sometimes, if you're trying to limit, if you're going out of the house, and so it's hard to stay on top of fresh fruit in the house. So frozen organic, I think can be just as good in my book. So I know that's kind of a common question.
Yeah.
And then kale. I do like obviously fresh kale. And kale is so versatile. And so you can throw it in a smoothie, or one of my favorites is making kale chips. Have you guys made kale chips?
We haven't made them, but I know what they are.
Oh my gosh, you will be surprised. If anyone loves chips, then I fully recommend, that crunch or that salty thing that you crave.
Mhm.
It's super easy. Can I tell you how to do it?
Yeah.
Will you make it today, Chris?
I don't have any kale at home, but we
Oh,
buy a whole bunch and we have a garden, so we will be planting it.
okay. So on your first harvest,
Yeah.
you chop up the kale, and then we put it in a big bowl, and maybe you just do like 1 bushel. Put it in a bowl, toss it with an oil, like I like avocado or olive oil, and then a seasoning of your choice. Like you could get fun and do some fun flavors, or you could keep it simple and just do, some salt, and toss it so it's nicely coated. Put it on a baking sheet, kind of spread it out. And then 350-ish for like 10, 12 minutes.
Wow.
And it comes out lightly crispy and
Wow. Sounds pretty easy. I'll have to try it because kale's pretty that's a smoothie food for me. Just throw it in there and mask it with other things.
you will be, I think you will be surprised.
All right. I'll let you know.
Yeah.
Okay.
Sounds good.
That's 3. We said chia seeds, we said broccoli, kale, and
Ginger.
ginger. That's right. Okay. Yeah, I think one of the only times we really eat ginger is when we go out for sushi.
Yeah. So buying it in the grocery store, when I first bought it, it looked intimidating because
It's like a little root, gangly thing.
It's a root,
Yeah.
and it has like kind of a thick looking outer coating.
Yeah.
Feel. And so it's just interesting, like working with certain foods and a couple more. We are in Southern California, which is, I don't know, I feel like we're the mecca of avocados.
Mm-hmm.
Well, Fallbrook at least.
Yeah.
And so avocados actually have anti-inflammatory properties as well. So hit up your friends that have farms.
Yeah. The property that we live on actually used to have an avocado grove, but it was costing too much to like water them all, so there's none on there anymore. But yeah, having local avocados is huge.
Yeah.
Gotcha. So now we talked about the importance of eating anti-inflammatory foods for the sake of lowering inflammation. We lower inflammation to lower stress levels. And not only is that lowering stress levels within our digestive system, so that way we can avoid, indigestion, constipation, reflux, heartburn, the bloating, those type of symptoms. But when we're taking care of our gut, we hear all the way around, like we're also taking care of our brain or our nervous system. Would you mind going in a little bit how these foods are not only impacting the health of our digestive system, but how like that ripples into other systems within the body?
Yeah. So the digestive system is strongly linked to the immune system. And you probably know the answer, but I'm going to ask our audience. Guess how much of your immune cells are in your gut? Shocking. The answer is 80 to 90%.
Crazy.
80 to 90% of your immune system is in your gut. And it's so interesting because, we talk about, I had this gut feeling, and now I love that gut health, is on everyone's minds. Another crazy fact is that, do you know how many organisms live in the gut?
Gosh, if they even can number them all, huh? Isn't it in the trillions?
Yeah, like 100. Supposedly, it's like 100 trillion. Like I can't even really fathom, that number. But of live organisms that live in our gut, and their job is to protect us from infection. Their job is to regulate our metabolism, and help with the mucosa lining, which are things like our respiratory tract, like in our nose. And one side note, you guys, right now our respiratory tract is being threatened by the COVID-19 virus. And an important part of your immune system and the mucosa, meaning the lining in it, in your nose, in your mouth, in your gut, that lining needs to be, it's called the mucosa. You think about that, mucus.
Mm-hmm.
What does mucus mean? We know mucus is supposed to be kind of slippery. You will not be slippery, AKA you will not have the best mucosa if you are dehydrated. So please be drinking enough water. And what enough water is, for those who don't know, is half of your body weight in ounces. So let's pretend you weigh 200 pounds. Half of that is 100. So that person would drink 100 ounces. And herbal tea, you can count. So let's pretend you're like, gosh, I hate water. I just don't like to drink it. Well, make herbal tea. Make it cold brew herbal tea. So yeah.
Nice. Cool. That's super helpful. And I had a thought when we were talking about, because obviously I teach that stuff of the immune, gut correlation and that sort of thing. The question, which it never has up until now, why would 80% of the immune system lie within the digestive system? And it came to me, and because the digestive system is essentially a tube, like that starts here and ends down below. So it is actually it's not really like an external organ where it's being exposed to everything that's going on in the outside world. So that makes sense for the immune system to be majorly in the areas that are being exposed to the outside environment, which makes sense then when it's inflamed, why it's going to go on hyperdrive, because we talk about stress on the inside. The more stress you have on the inside, kind of like a bucket analogy, like the more full your bucket is, the less water you can fill, the more higher, if you're up to the rafters in stress, you only have room for a little bit more stress, your body's going to start overreacting. Yeah, there it is. Yeah. Because it doesn't want to take on any more. So that makes complete sense. So if your digestive system is stressed, it's because your outside or your immune system is going to be stressed, which means that it's going to overreact or underreact to any of the stresses coming in from the outside.
Yeah, that's so true. And I love how we speak the same language. I say the same thing to my patients all the time. Between here, and your rectum, it's all the same. It is one long tube.
Yeah.
And not, this wasn't going to be a topic of conversation, but I'm passionate about dental health. That dental medicine, there are many diseases out there that start in the mouth.
Yeah.
And for those watching, I tell people, do not get a root canal. You couldn't pay me to get a root canal.
Interesting.
And boy, would I love for my student loans to be paid off.
Right. Maybe we'll have to have another discussion about that, because I feel like that's not something that's commonly talked about. And there's books, obviously there are hundreds of books on the gut-brain connection, brain-gut connection, blah, blah, blah. And there's one book, it's in my Amazon cart if anyone wants to send me a gift or a wish list or whatever. But it's the mouth-brain connection. Because you think about, there's like a little tiny bone between the mouth and the brain. If your mouth is inflamed, then that's gonna, but anyways, we're going on a side tangent. But
yeah, sorry.
It's definitely, important. What we're putting in our mouth is super important. And it's interesting when you bring that up, to kind of tying in like what I see with kids. Kids are always having their fingers in their mouth. And so it's really important that the brain is getting used to the, the external environment. But if your mouth isn't healthy, those bad bacteria are going to work on overtime, which means that's when you're going to get infections and whatnot all over the place. So it's not about keeping all bacteria away. Like we talked about, there's trillions of them. There's no way. It's all about, keeping a healthy ecosystem. So the good ones can overcome the bad ones when necessary.
Exactly. And our food is the soil for the garden of microbes that we it'll either promote them or not give them the proper environment and the food sources, because the bacteria are feeding off of our fiber and different nutrients. And they actually metabolize some nutrients for us. Some B12 and vitamin K is partly metabolized, metabolites coming from the bacteria digesting our food, and then they make some vitamins for us.
Wow.
Yeah.
One ecosystem.
Yeah.
And so then you put that in the food context. What are bacteria going to do with Cheetos?
Yeah, they're going to have a heyday.
Thank you for this orange powder, human. Now, how am I supposed to make vitamin A? Or, but,
Yeah. And,
yeah.
I use this analogy. It's like a party. It's like, who do you want at your party? Because if there's a group of bad people, it's going to invite more trouble.
Mm-hmm.
So we want those bad people out, bad bacteria.
Yeah. That's great. You want a good party, not a terrible party that the police are going to have to come to. Okay, so moving on to our next topic. Let's say we're going to try to eat healthier. We want to eat these anti-inflammatory foods. We want to expand, our palate a little bit, or we want to incorporate other sauces or things like that. We talk about the top things that are anti-inflammatory. We both agree on probably the top 3 things that are pro-inflammatory, sugar being number 1, dairy, gluten usually being 2 and 3. You can switch up that order, but usually, sugar is going to be high up in number 1.
Yeah.
If somebody's trying to add extra sauces or use other ingredients, or are trying to make that shift away from pro-inflammatory foods and into anti-inflammatory foods, what are some common I call them sneakers? What are some common foods that might have gluten or a high amount of sugar or things like that parents wouldn't normally think it's that bad?
Yeah, lunch meat.
Oh.
Lunch meat, and right now I'm sure sandwiches are really popular. And I just want to say my heart is with you parents. I don't have children yet, and I can only imagine, that your guys's role, if you weren't already homeschooling and now you are, I just am like, oh my gosh, you're not getting a break with COVID. You've got more on your plate. So much love to all the parents out there. So lunch meat, you want to be careful. And, I'll just throw, kind of what in my world, I feel like it's a buzzword, but nitrates. So, that's another, not just the sugar in lunch meat, but the nitrates in lunch meat. Sugar could also come in, a lot of us are maybe like gluten-free pasta. There's nothing wrong with gluten-free pasta, but your marinara sauce or your spaghetti sauce, you need to look, and there are brands that don't formulate with sugar, but most of them do. Yeah. And let's see, one other thing, where else do I see sugar? Well, I'm going to say, yeah, that's what exactly. And I mean, that's a double whammy with it's not sugar, it's dairy as well. And even if you get a coconut milk yogurt, it's still, unless I would say maybe if you like yogurt, it's I would want you to do a non, a Greek plain,
right.
As a special treat.
Yeah. We bought, I think it was one of those nut yogurts, which is weird to say, but and I was like, Jess, do you know how much sugar? It looks clean, it didn't really look and it had 15 grams of sugar per serving. I'm like, go pull out your ice cream and see, and it was the same. It's oh
wow,
I know, especially now, because every time I go to Barron's or the grocery store right now, usually that dairy aisle is just wiped, including the yogurts and all that stuff. I have a lot of when back to school time comes in and kids are speed eating and out the way off the door. A lot of times if yogurt, especially you add syrup to it, or you add, even some fruit to it, or, something like that.
Yeah.
Just giving your kid a bowl of ice cream before school, and no wonder they're going to be wired for first period, not wanting to sit down or, do anything like that.
Yeah. Yeah. And, yeah, that's a different topic, but I guess the moral of the story is please stay away from these things.
Yeah. Now, perfect transition into kind of what we want to talk about next is okay, so here's kind of a list of things that, pro-inflammatory, anti-inflammatory, how we can eat them, what type of things to avoid. How do I know that my body is stressed? What are maybe some signs and symptoms that I am eating too much sugar, or that dairy does affect me, or that I am affected by gluten, or just overall, how do I put together a symptom that maybe I can get a medication for with a root cause that I actually want to, overcome?
Yeah, that's great. So, One way, so this is an interesting question, and I don't want to make anyone feel uncomfortable, but I want to remind you guys that we are doctors, and so we need to talk about the number two. And so number two, meaning your bowel movements, because that's going to tell you a lot of information. And so it is important, look inside the bowl, before you flush and see what it looks like. What's the color? What's the shape? Do you see any digested food? Do you see any mucus? And there is something that I would like you guys to write down. So grab a piece of paper real quick and write Bristol, Bristol, Bristol stool chart. And so when you look that up, it's gonna, you pull up images on Google, and any image will suffice because it's all the same standard chart. It's a standardized chart that shows you type 1 to type 7 and the different pictures of what different shapes of poop or consistency of poop can look like. And we're really wanting a type 3 or a type 4. That is what is normal. And ideally, you are having a bowel movement every single day. And some even say more than once a day. In theory, if you're eating 3 meals, in theory, if things are moving out as they should, you would have 3. I don't find that that's common for most of us. And I think, your body has its own way, and I also want to kind of honor that within the confines of what's normal. Meaning we may not ever get to that 3 bowel movement a day, but if you're going once a day and it's consistent and things are coming out, that's fine. If you're going more than, every other day, that's a big problem that should be addressed.
Yeah.
Also, if you're experiencing gas or bloating, these are signs of bacteria who are metabolizing things, and their metabolites are gas is what I'm trying to say. Gas is the byproduct of their metabolism. And the bloating is symptomatic of maldigestion. And so have those kind of gut issues. And then other signs that that you're stressed are just like, be in your body. Like, are you having heart palpitations? Are you, finding that you're like chewing? Like sometimes I notice like I might chew on the corner of my mouth. Yes. Good demonstration. If you are having any sleep disturbances, like let's say you're, waking up a lot in the middle of the night, that's definitely, maybe it's not digestive stress, but now I'm kind of talking just broad spectrum stress. Also, if you've had any like personality changes, if you're really short fused now and you're maybe you're normally a pretty patient person and now you're finding yourself being snappy or irritable. And lastly, for women, hair loss. Maybe for men too, but men normally have short hair. There's different, reasons. My husband, doesn't have any hair on his head. And actually, unfortunately, he did lose a lot of it when he went through a stressful event, when his father had a actually traumatic brain injury. And so the body, like any sign in your body, I want you guys, all who are watching, you need to be a detective. I sometimes tell my patients that's what I am. I'm going to go with you on a journey, and we're going to play detective together. And you need to know kind of what is your body showing you.
Yeah, and this didn't happen until after chiropractic school.
Yeah.
It's crazy looking at pictures like before I started school and afterwards, and it's like I aged 10 years just in that 3 years of amount of time, or 3.5 years, however much it is. But
yeah,
that stress does that.
Yeah.
The last kind of topic that we really wanted to dive into together, which is really like your wheelhouse of where I really refer a lot of people, is looking at stress, but then also what is stress doing to hormones, whether it's like thyroid hormone or reproductive hormones, or because those can cause a wide array of symptoms that, you can be, if you go to a medical doctor, you can be getting, anti-anxiety medications to thyroid medications to this and that, and that may be way downstream from where the problem actually is. So when you're undergoing stress long enough, that doesn't get taken care of, whether your diet is terrible or emotional stress. So if this COVID thing goes on for months at a time, like they're saying it might, or physical stress, any of those things, how is that going to start messing with your hormones? And do you work on like hormones with guys too, or just girls?
Yeah, men and women. So that's a great question. So the first hormone that I'd like to touch on is, everyone kind of knows this one, I think, is cortisol, because cortisol is our main, we call it the stress hormone. But what's important is cortisol is so much more than a stress hormone. It actually helps regulate it does have effects on our immune system, on our energy levels, it's related to weight. So it's an important thing. And I say it's like Goldilocks. Much of our hormones are like Goldilocks, where we don't want it too low, we don't want it too high, we want it just right. So right now, if somebody has lived up to right now, like kind of a calm, cool, collected life, and this, the stressor really that we're all experiencing on different levels of COVID-19, in the short term, what your body does is it jacks up cortisol. So in the short term, it's like, there is a tiger and we need to run from the tiger. We are still that evolutionary being from so many years ago of our ancestors who, had to gather and hunt for survival. And so cortisol helps you get through it. It helps you with the deadline. It helps moms probably push a little harder, and dads, go out to work and blah, blah, blah. And so it's great. It does its job. It rises high. And normally we want our cortisol levels, which, by the way, if you're like, can that be tested? Yes, it can. And so you want your cortisol levels high in the morning, but not too high. And then ideally they come down low. So it's like in the morning, you've got to get that boost of energy to conquer the day. And then at night, you want your cortisol level to be low so you could fall asleep. Now, going back to that sleep disturbance that I mentioned, one would think, okay, if you're having insomnia, I want to look at your nighttime salivary cortisol, because I want to know if it's too high and if that is the cause of the insomnia. For many people it is, not everybody. So now let's pretend we've been running from the tiger. And running from the tiger in our, culture right now is working long hours, not having proper blood sugar regulation, having emotional turmoil, strained relationships. The list can go on with what is our tiger and what our cortisol is responding to. Long term, what happens is it's no longer high. You cannot play at this level for too long. What happens is you will drop, and it is called sometimes adrenal burnout. I think we're getting away from that phrase, but that's essentially what it is that then your body will no longer be able to produce adequate cortisol, and you may even need cortisol supplementation in the form of hydrocortisone if you're not producing enough. And those are the people that can't get out of bed, that are like, oh my gosh, I am so tired, I am barely functioning. If you are barely functioning, I would strongly suggest that you read about low cortisol, because that might be your problem.
Yeah, that's super helpful. And one thing that I learned with EMS, so it's like the radiation that's coming off, the screens right now, or your phones or whatever. If you have your on like normal brightness at night, the EMF radiation that your body is getting, it's something like 12 times the amount that your body would get at noon, like standing out in the sun. So like being out in the sun like stimulates cortisol, right? Because that's like what keeps you going. Yeah. And then as the sun goes down, melatonin comes up, cortisol goes down. And having your phone keeps it jacked up, you know what I mean, and ramped up high, not just like a little bit, like if you have a Kindle or a flashlight, you know what I mean, something that's not really emitting that much radiation. And so you're right. I mean, if you're going through a stressful day, and then at night to wind down, you're just staring at your screen on full, you know, bright mode without, you know, blue light filters or anything like that, you're continuing to tax that system. So while it should be getting, you know, 8 hours of replenishment, you know, more than that, probably at least when you're sleeping.
Yeah.
So if you're running at full steam ahead for 16 hours, I mean, there's no way those bodies are going to recover. And like you said, over time, we're going to be feeling that. And then we know the signs and symptoms of stress. And then we go after stress eating. And then, you know what I mean? And it just tornadoes and cycles into, oh, I'm depressed, I must need antidepressants. You know what I mean? Like, well, here's all the things that we can try first, because here's all the things that are linked to serotonin, or here's all the things that are linked, you know what I mean? So,
yeah.
Go ahead.
And healthy adrenals are that center because they will affect the thyroid. They will affect our sex hormones, and they actually help us make sex hormones. Our adrenal glands help with testosterone, estrogen, and progesterone production. And so for the women out there, I'm like, we have to take care of our adrenal glands today, because when I get to menopause, I don't want to be suffering. Right. And I will be suffering if my adrenal glands have overworked themselves and can't make me estrogen and progesterone and testosterone. Like I'll need bioidentical replacement. And fine. But wouldn't it be great if the body, if we just did what it does, you know, and lived, didn't need things to keep us going.
Right. Yeah. And that's the goal. You know, you want to help the body do what it does best, which is not only survive, but adapt and thrive, you know, in our environment.
Yeah.
Cool. Well, I mean, that was super helpful for me, just thinking, you know, just troubleshooting things. Because a lot of the times I look at one part of the problem and I don't dive into, you know, other issues. So this is super helpful for me. I know it's going to be super helpful for everybody else.
Oh, good.
What are some ways that people can connect with you?
So on social media, very easy. It's just my handle is Dr. as in Dr. Alisha, Alisha, and ND, Dr. Alisha ND, and then website dralishaND.com.
Perfect. Pretty simple. And I'll when I like edit this a little bit, I'll put it like beneath too, so that people can see it. Any closing remarks or anything, parting breath exercise that we wanted to do?
Yes. Yeah. So, so to all of our cortisol levels, you guys are probably elevated yesterday. And what I really want, what my experience was yesterday, I had a stressful day. Part of a lot of that stress, you guys, was actually in here. I had to have a difficult conversation, and I made up so much in my head of what that conversation was going to be like. And I was sweating at like 6 a.m, sitting there. And I'm like, and I didn't have heart palpitations, but you know, I was sweating. So I was like, oh my gosh, my body is having this physiological response. So what I try to do, there's actually 2 exercises. We'll save the other one for our next conversation.
Perfect.
And so this one I got from one of my favorite doctors for a while. And the breath work that he recommends that we do is super simple. Inhale for 4 counts. We're going to hold for 7. We're going to slowly exhale for 8 counts, having the tip of our tongue on top of our palate. I don't know why physiologically or neurologically that's beneficial. Do you know? Okay.
Out through your nose or through your mouth?
Out through your mouth. Thank you.
In through your nose, out through the mouth.
Yep. All right. Let's inhale for 4. Hold for 7. Exhale for 8. And we would normally repeat that 2 to 4 times. And he advocates doing that twice a day. So maybe first thing in the morning, last thing at night, and doing it over 6 weeks, and that there can be profound physiological effects in your body from it.
Crazy. It's crazy to me thinking how simple, like health can really become. Like, I feel like in America, we've made it so complex. Breathe right, eat well, sleep more, and drink water. Like, you know what I mean? Like, we have all these degrees in education and, like, all this stuff. Eat what comes out of the ground, sleep when you're tired, and stop putting electronic stuff, like, you know what I mean? It's so interesting.
Yeah.
Because and what's even more interesting, so I've interviewed, or I'll stop recording, or I'll say after recording. Anything else that you want to leave us with?
No, thank you. Thank you so much for your time and attention. And like I said, you guys pick one thing that you heard us do today and make it make a difference. Knowledge is not power, action is.
I love it. Cool. Well, thank you so much. And we will talk to you soon.